When caring for patients receiving any kind of diuretic therapy, the nurse should remember the following. If giving a daily dose, administer the medication early in the day so patients will not have their sleep disturbed because of frequent trips to the bathroom. Assess skin turgor and mucous membranes for signs of dehydration. Monitor fluid intake and output. Make sure the patient is aware of the need to limit fluid intake to achieve results. Check weight daily for a gain or loss greater than 2 pounds per day. Monitor electrolytes and glucose levels. And monitor for signs of hypovolemia such as tachycardia and hypotension. Begin teaching patients who will be taking diuretics at home about drug actions and the need to monitor their weight closely, not to take in excessive amounts of fluids, the need to sit up slowly if orthostatic hypotension is present, and the need to have their electrolytes checked on a regular basis. The causes of heart failure include high blood pressure, coronary artery disease, valvular disorders, and myocardial infarction, which decrease contractility. Knowing the specific cause helps guide the choice of drug therapy. The goal is to improve circulation. In addition to the drugs discussed in this program, angina and high blood pressure medications, which were discussed in previous programs, may also be beneficial. High blood cholesterol levels are measurable in lab tests and may be the result of genetics or secondary causes such as lifestyle and diet or other disease processes. A major risk factor for atherosclerosis is elevated cholesterol. Cholesterol, triglycerides, and phospholipids are transported in plasma. As more and more studies indicate that lowering cholesterol decreases morbidity and mortality, cholesterol-lowering drugs are increasingly being prescribed. In addition to a total cholesterol level, other factors to consider include high-density lipoprotein level, or HDL, low-density lipoprotein level, or LDL, and the ratios between them. These ratios are factors of the total cholesterol level to the HDL and the HDL to the LDL. This provides a more accurate picture of a patient's risk level. For example, a borderline high cholesterol level of 200 might not be considered problematic if the total cholesterol level to HDL ratio is less than 3.
Hi, Juan. It's good to see you again. We called you in today because remember we did the cholesterol level? I wanted to show you that it had gone up a little bit. It's still high.
Yes.
And I know that we had put you on that diet and that exercise plan.
In cases where attempts to control the cholesterol level with diet and exercise have failed, cholesterol-lowering medications may be prescribed. These medications, which include cholestyramine or lovastatin, lower circulating levels of low-density lipoproteins or interfere with cholesterol synthesis. Triglyceride-lowering agents such as gemfibrozil decrease lipoprotein and triglyceride synthesis.
The doctors prescribe lovastatin for you.
Yes.
It's a medication that's going to help lower your cholesterol, okay? And the onset of this medication will take a couple weeks. So we really need you to be dedicated to taking that one pill every day.
Yes.
And then we'll see you back in a month and we'll do the blood test.
Because these medications act in the liver, liver dysfunction is a contraindication, and monitoring of liver function tests are recommended periodically for patients taking these medications. Renal impairment and pregnancy are also contraindications and must be ruled out prior to these medications being prescribed. In addition, cholesterol-lowering medications can potentiate the effect of oral anticoagulants. Associated gastrointestinal problems are the most common side effects. Since many patients with cardiac problems are on multiple medications, a complete medical history, including all current drug interventions, must be compiled.